Good afternoon. I'm Cody Barnett with Bodyworks Physical Therapy and Concussion Center located in Wichita, Kansas, and I thank you for inviting me here today to speak. I'll never forget the look of despair on the face of the woman that was sitting in front of me. Suzanne was a 60-year-old woman who was suffering with severe back pain and sciatica, and she'd been planning this big trip with her family, with her daughter and her grandkids to go to Disney World. The trip was coming up in a month. One big problem: she couldn't walk more than 5 minutes without having to sit down because of excruciating pain. So all that planning was going to be wasted if she couldn't go. What was worse was that she's worried about missing out on the trip of a lifetime with her grandchildren, and this is what was keeping her up at night. Prior to our appointment together, Suzanne had had an MRI done. She'd actually seen two different surgeons, two physical therapists. All of them gave her the same diagnosis. You have degenerative disc disease and arthritis. Two of the providers had recommended surgery. One had recommended medication, and one had told her that there was nothing that could be done. So during our first visit together, I asked Suzanne a lot of questions. I asked her about where the pain was, when it would hurt, what things that she found that would help relieve her pain. I asked her what she thought was going on. After that, I then commenced with our examination together. I was examining her back and her leg and her nerves and so forth. And during this exam, she turned to me and she said the most amazing thing. "You're the first person to actually put your hands on my back and examine it and touch my pain." This really cut me to the heart. This poor woman had been suffering for weeks, and no one had bothered to perform a physical examination on her back. They had based all their recommendations based solely on the MRI report. So after I examined her back, tested her nerves, checked her strength, her mobility, etc., I told her, "Suzanne, it's very true you've got a lot of arthritis in your back, and it's pretty bad, but I'm not convinced that arthritis is causing your pain. I believe you have a muscle that's causing pressure on a nerve, and if we can fix that, your pain will go away." So what's our takeaway? If you're a healthcare professional here with us today, remember who is sitting in front of you. It's a real person. They might be concerned about a trip with their grandkids. They might be concerned about being able to continue to go on walks with their spouse. They may be concerned that they're going to be able to continue to work in the garden. They might be worried about being able to continue to go golfing or play pickleball with their buddies on Friday afternoon. But the point is, it's a person. And we fail our patients when we don't take into account what it is that they're trying to achieve. We have a saying at our office: we treat people, not MRIs. Now, am I against MRIs and x-rays? Not at all. That would be ludicrous. But we must always correlate what we find on the MRI with what our patient's telling us and what we find during our exam. And all three of these factors all need to be able to be in agreement with each other. Now, if you're somebody in the audience today and you're suffering with back pain, neck pain, sciatica, etc., I implore you to seek out a provider who's going to listen. Someone who's highly qualified and specializes in back pain, yes, but primarily someone who's going to listen to you and make the time to learn about your specific problem and your specific needs and concerns. Seek out someone who's going to individualize your care based on what it is that you need to achieve and not on some cookie-cutter protocol. And lastly, if needed, get another opinion. You are the person suffering. You are the person who's losing sleep every night. And you are the person that's saying no to activities with your friends and family that you used to be saying yes to. I want you to be like Suzanne. And if you have an unsatisfactory experience with a provider, go see another one who's going to listen and give you the time that you need and the time that you deserve. And what happened to our friend Suzanne? Well, I'm happy to report not only did she avoid back surgery, not only did she avoid a life of pain pills, but she had an amazing trip with her daughter and her grandkids, and best of all, she was able to make memories that will last a lifetime. Thank you.